So I'd like to welcome Karen and Kristen. And we're going to get started with Karen, who's going to walk us through a presentation that gives us an overview on the link between nutrition and mental health and some of the emerging research. So Karen, mental health can mean many things to different people, from a bad mood, loneliness, stress, to addictions, to clinical depression. How do you define mental health?
So when I think about mental health, I like to refer to the World Health Organization's definition, which outlines these key features of mental health that include a state of well-being in which every individual realizes his or her own potential. And mental health is also this resource that can help people cope with the normal stresses of life. And finally, to act as a means or a mechanism which helps one make a contribution to his or her community. And so on this slide as well, I show this Continuum model from Keys, and it shows mental health occurring in 4 different quadrants. So when we define mental health, it goes beyond just categorizing people as being mentally healthy or mentally ill. Each quadrant here highlights the 4 possible experiences that each person may have with respect to their mental health. So just like a person who has a physical health condition, someone with a mental health condition can have a healthy life, as shown in quadrant 2 on this slide. On the other hand, a person can experience poor mental health, but be free of a diagnosed mental health condition, as shown in quadrant 3 on this slide. So I'm just going to click back here for a minute and outline sort of what I plan to present here for about the next 10 minutes. So I've just defined mental health, and then I'm going to go into describing a bit about the relationships between diet and mental health, and talking about those structural barriers that Trace has also introduced that impact mental health and nutrition, and then highlight some case examples that promote mental and nutritional health. So skipping ahead, when we think about diet and mental health, we often think about how nutrition links with brain function. So as you see at the top of the slide here, there's a number of different categories of nutrients that I've outlined here. So when we talk about, say, the carbohydrates, well, those form the fuel that is needed for the brain, and that form in which is used is glucose. And then, of course, we hear a lot about fats and its impact on health. And in particular, the essential fats, or the omega-3 fatty acids, are really what's crucial to brain health. And then proteins, which is another of these major nutrients, is important to mental health in terms of providing the amino acids, or those building blocks, which form the neurotransmitters or the chemical messengers in the brain. Also, when we talk about the nutrients, we consider the micronutrients, or what we call the minor nutrients, in mental health. So those include the vitamins and minerals. So when we think about the vitamins, the main ones that really are linked are folate, B12, or vitamin B12 and vitamin B6, for example, as well as the antioxidants, which help to reduce inflammation. So those being, say, vitamin A and vitamin C. And then the other category of the minor nutrients are the minerals. And the main ones that come out as having a role in mental health include iron, for example, and zinc. So besides the nutrients, we also have a lot of other substances that are found primarily in plant foods that we call the bioactive substances that are also very important to mental health. So, for example, the flavonoids that you may hear about can help, for example, in conditions that promote cognitive decline. So it can help to prevent, say, dementia. In the middle of the slide, I just illustrate there are some different nutrients that are linked with mental health and the symptoms that they're associated with. And as you can see, I put a number of footnotes there. The research linking diet and mental health has been around for a long time. Some of those references say coming from the 1940s. And so we know a lot about diet and mental health, but it seems to really be coming out to the forefront now. When I started talking about this, I talked about brain function, but I really also want to highlight that mental health and diet is also an interplay of other systems in the body. So for example, how our blood vessels, our circulation operates, our gut function, our immune system, and our hormones. So all of these systems work together to promote mental health. So if we think at the very basic level, for example, when we eat food, it gets absorbed through the intestines or the gut. And then we also need healthy blood vessels in order to transport those nutrients from food to our brain. So if we were to say, to give one message around nutrition and mental health in terms of a diet that would promote it, basically, the emphasis is a healthy diet, which may be described, for example, as a traditional diet, the Mediterranean type diet, a plant-based focused diet. And the key messages there being that the diet should emphasize low fat, but yet promote intakes of the essential fats that we can get, say, from cold water fish or from flaxseed, as well as incorporating an abundance of plant foods from vegetables and fruits that, say, can come from fresh or dried sources, the whole grains, the nuts, the legumes, such as navy beans, lentils, kidney beans. And then, of course, really emphasizing the vegetables and those that are the dark leafy green type that provide folate, as well as orange and brightly colored vegetables. So attention to these will promote mental health for most people. But in this slide that I show here, there's also people that would need specialized attention when it comes to their nutrition and promoting their mental health. So in these cases, they would need a tailored plan where they might meet, say, with a registered dietitian who would review their food and supplement intake, look at their current mental health symptoms, for example, and then also consider the context in which the person is in, such as their living situation. And then they would work, say, with that registered dietitian to come up with an individualized plan that's going to stabilize their health, both their physical and mental health, maximize the effectiveness of, say, the medications that they may be taking, and also to support healthy behaviors. So, for example, some people who may be struggling with mental health symptoms may also start developing these distorted eating behaviors, such as extreme dieting behaviors, for example. And so work would need to be done around that to resolve those behaviors and promote healthy eating. So then the overarching goal then is to get that person to function at the highest level of independent living possible. So earlier I talked about different studies that linked specific nutrients and mental health symptoms. More recently, there's been a lot of epidemiological research that's out there. So looking at mental health and a population at one point in time or over a time period. And so on this slide are some examples of some key studies. And really, all of those studies point to the same message. A healthier diet is associated with improved mental health. And when we talk about improved mental health, that means, for example, you can help prevent or delay the onset of a mental health condition, or it can also mean to improve symptoms that a person may be experiencing, such as depression or mania, psychosis, those type of things. And then more recently, a study came out this year by Felice Jacka, who's the international expert on psychiatry and nutrition. And what it shows is that, of course, there's this link between diet and, say, depression, but part of that link is explained by socioeconomic factors. So there's a number of different factors, for example, but the main one that really impacts nutrition and mental health is poverty. So in this slide here, I'm illustrating this cycle of poverty, which can impact both one's diet and mental health. So for example, if we take a person who has a lack of income for a number of different reasons, for example, they may have lost their job, or there may have been a family member who's died in their family, that puts them in a situation where they lack financial resources. And of course, then that can impact on other factors such as getting adequate housing, getting access to food. And so then also, because they're coping with this stress, they have reduced resources to manage it. And so then we get this chronic cycle that gets set up where more stressors get added on to that original one, which was poverty. And then they have these reduced resources in which to cope with these additional stressors. So then they get stuck in this chronic cycle of poverty. And so we know that the material and social deprivation associated with poverty is a primary cause of both poor physical and mental health. And that in order to address mental health promotion, we need to look at this relationship very closely. And so, as I was mentioning, when we talk about nutrition and mental health, there's many complex intersections, as illustrated in the previous slide. And here I just want to show that for particular groups in our population, there is additional struggles that they face that impact on their mental health. And these struggles are around social exclusion. So, for example, interventions that are trauma-informed, that focus on the principles of harm reduction, for example, as well as providing services that are accessible and easy to navigate for the person. And then, of course, we need to tailor different services and programs to key groups. And for people that work within those programs to ensure that they have training around cultural sensitivity and anti-oppression. As shown in this slide, really there's these multiple layers of risk factors when it comes to diet and mental health. And so then we need an integrated and population health approaches in order to adequately address these issues and help us to move forward. So on this slide, I'm just showing examples of different programs across Canada and internationally that help to promote nutrition and mental health and are targeted at different points in the lifespan. So I'm going to highlight a couple of them as examples. So the first one there, looking at the perinatal period, the Canada Prenatal Nutrition Program that's been around for a number of years and is in more than 300 different communities in Canada is a really unique program in that it offers peer counseling as part of its service delivery. And this is peer counseling for pregnant moms who are facing challenging life circumstances. And in addition to that, there's also weekly or even more frequent than that drop-ins where pregnant moms can come in and connect with other pregnant moms and with the peers and staff. And they learn about different topics related to pregnancy and they get this healthy, nutritious meal along with that. And then another important component of this program is that many of them offer food and nutrient supplements. And so those foods are foods that would promote health during pregnancy, and the supplements are the prenatal type supplements, which, for example, provide higher levels of iron and folate, which are important to mental health and the neural development in the fetus. Another program that I'd like to highlight is one that's focused to adults, and that's the Minding Our Bodies program of the Canadian Mental Health Association of Ontario. And this program is targeted towards people with serious mental health conditions and helps to foster healthy living around physical activity and healthy eating. And it has a number of tools that are available online that people can access, toolkits to get programs started in their community, which they can tailor to their own circumstances. So those are just an example of a couple of programs. There's a number of other programs which I haven't talked about, but you can certainly go to those and get many more ideas of how you might look locally at your community and implement different models that can help promote nutrition and mental health. So then, just to summarize, hopefully the message that you've been getting from my presentation is that there's many lines of evidence that link nutrition and mental health, many different types of studies that support these links. And that really an important component of this is that there's many structural barriers that people can face that impact their nutrition and mental health, and that we need to address those structural barriers so that we're all on an equal footing. And then finally, many different programs are available that are out there, and that we need to integrate different strategies that incorporate different interventions. And these can produce very high returns on investment, not only from a financial standpoint, but from a human potential viewpoint as well.